fight against COVID-19. Prime Minister Narendra Modi is going to hold a fresh round of consultations with chief ministers this week as the country gradually emerges out of the lockdown. The two-day virtual meeting comes amid the backdrop of rising number of coronavirus cases in the country. Parveena is joining us live from the national capital. Deepak from Bengaluru is also with us. But Parveena, coming to you first, the concern of the national capital and the upward trajectory as far as the cases is concerned has been a worrying trend, not just for the Delhi government, but also for the centre.
Well, absolutely. As we have seen that the lockdown, as we've entered the unlocked of, most of the places in Delhi except the containment zones, we are also seeing the rise in positive cases, and it has been a matter of concern for different bodies and authorities as 24 hours the ratio is 2,000 cases each day. It's crossed that mark, and also the death rate has also increased. And amidst that, we are also getting figures like over 5 lakh cases which are expecting by 31st of July, and we need 80,000 more beds. What is the state government really looking at is a matter of concern now. Also, we know that that in the mechanism which was adopted in between by Delhi government was Delhi hospitals for Delhi people, which was overruled by Lieutenant Governor, that this will not help any patient coming from any place or any location, any state will get admission. In that case, what is the plan that they have? That all is something the Lieutenant Governor himself has asked the state government to make a plan and present to him. Also, we know, looking at the rise of cases in the national capital, today Home Minister along with Union Health Minister will be meeting Delhi Chief Minister, will be meeting Director of AIIMS and also Lieutenant Governor to know that what is the plan they will devise and what is their future roadmap for the national capital. Because remember, Satyendra Jain has cleared that lockdown is not an option. He has discarded that option. In that case, if everything is opened up, people are out there and the numbers are rising, what is the plan that the state government has? That has to be looked upon now as to what will they plan and how do they plan to reduce the number of cases.
Because as far as the projection of the number of cases in the national capital goes, by the projection that has been put out by the Kejriwal government itself, the numbers are staggering, and a plan to be put in place is the urgent need of the hour. Parveena, stay with us. Deepak also joining us on this broadcast. Deepak, now if you compare other metropolises to Bengaluru thankfully has managed to keep a steady pace in the number of cases. We haven't seen an uptick like Mumbai or Delhi has witnessed over the last couple of days. That is also now leading to, we're given to believe that several changes in protocol as far as containment zones is concerned in Bengaluru.
Yes, but we should understand that Bengaluru went into lockdown even before the national lockdown, and that somewhere helped the city contain or manage the virus a little better than most of the other metros did, because at the time where it was actually spreading, the city was locked down, offices were shut, there was very little activity on the streets. Now, as far as the city of Bengaluru and Karnataka is concerned, yes, they're planning to move out of having large containment areas. Now they're making it into containment homes, containment offices, containment floors. This is the idea going forward, to allow maximum movement of people and a large number of people to actually go out there, carry out their businesses, making life much easier, because the lockdown period has been much larger. But the concern really here is the depreciating number of testing in Karnataka. We've had close to about 15,000 tests that was done, around last week. In the last couple of days, we've seen that drop to about 8,000. If you go by the data that's being put out, the main reason probably here is interstate travelers, all of them were tested before. Now they've decided not to test asymptomatic travelers. But the concern also here is that about 90% and above of the active cases are asymptomatic. So if you do not test, you wouldn't know that they have, the virus. They would be carrying it back home. Elders, young children at home, neighbors. It's a big potential risk. So when you have the capability of testing about 15,000, you can at least carry out random tests at this point in time to check for community spread. That too is not happening at an effective rate. So of course, underlying concerns are still there. But as you mentioned, the city and the state is fairly doing a little better compared to the others. But of course, that's nothing to be complacent about.
Absolutely, you cannot take your eye off the ball there, and I'm sure the Karnataka government there is very, very careful of what they're doing. Parveena and Deepak, thank you for joining us.